everyone. My name is Dr. Rupi Legha. I'm honored to share with you the vision behind the SHIELD Act campaign. This initiative is about creating equitable solutions for mental health crisis care so that no one dies when asking for help. It's time to make mental health care caring, not carceral. SHIELD stands for Safeguarding Health Interventions to Eliminate Lethal Disparities. We're starting with mental health crisis management, but I hope we'll take on other lethal health disparities too. Over 20 years ago, I experienced my own mental health crises, and the system that was supposed to help me just made everything worse. I was treated not as someone in desperate need of care, but like I was a criminal. It took me years to heal from the wounds it caused. Had the police been involved, I don't know if I would have survived. The utter terror I felt could easily have been misconstrued as aggression or violence and escalated to tragedy. Stories like mine and those of people like Yang Yang, whose mental health crisis ended in his tragic death, or Daniel Prude, who died in police custody during a similar crisis, are stark reminders that the current system is failing us. Equitable crisis care isn't optional, it's essential. The problem is that mental health crisis management can be deadly. Right now, when someone faces a mental health crisis, the standard recommendation is to call 911, 988, or mobile crisis. However, this can result in police involvement, leading to tragic outcomes. Shockingly, 50% of individuals killed by law enforcement are disabled, and mental health-related 911 calls disproportionately harm marginalized communities. This is not just healthcare failure, it's a systemic crisis. This fatal risk of police involvement during mental health crises is an established health inequity. However, healthcare providers are not required to protect the public from it or other racial health inequities shaping crisis care, like higher rates of misdiagnosis, involuntary hospitalization, and restraints for racially minoritized people. Failing to address these risks undermines a healthcare provider's oath to do no harm. Remarkably, mental health organizations and medical licensing boards have not issued any training competencies or practice mandates. Therefore, the solution is clear. We need trauma-informed, non-police responses to mental health crises. The SHIELD Act focuses on equipping healthcare providers with the tools to de-escalate crises safely and establishing community-based response teams that prioritize equity and compassion over enforcement. Step one is mandated training of healthcare providers to practice a new standard of care related to crisis management, one with a transparent, full informed consent process related to police involvement. This intervention operates upstream of mental health crises to prevent tragedies from happening. Step two is the development of non-police crisis teams, which is part of a national trend to decouple crisis response from policing. No more deaths during mental health crises. That's the goal. This initiative has the potential to save thousands of lives and prevent the trauma of wrongful deaths. By reducing police involvement in mental health crises, we'll not only achieve better outcomes for individuals, but also save millions in litigation and healthcare costs. I am a Harvard Medical School honors graduate, Fulbright scholar, and former global mental health fellow with a proven track record of leadership and impact. I've overseen a multi-million-dollar grant to establish community-based mental health services in Haiti, and I received every major psychiatry training award. With dozens of scholarly articles and a career spanning clinical care, education, and advocacy, I bring unparalleled expertise and dedication to advancing equitable, person-centered mental health care. My commitment is to shield and empower families through transformative and humane approaches to care. While my accolades may seem impressive, it's my survivor's story that is the most powerful. As Dr. Legha, my oath demands I protect the community from the harms baked into the mental health crisis continuum of care. As Rupi, my heart insists that no one suffers the way that I did 20 years ago. Our strategy includes passing critical legislation, piloting training programs for healthcare providers, building coalitions with community organizations, and publicizing stories as instruments of change. We can't do this alone. To make this vision a reality, we're seeking financial support for training programs and community outreach. If you're ready to join us in transforming mental health crisis care, let's connect. In the names of Yang Yang, Ryan Gaynor, Brandon Boyd, Daniel Prude, Sonia Massey, and countless others, we can answer the calling to create a system that saves lives and restores dignity while making mental health care caring, not carceral. Thank you very much.